The focus of functional medicine is to not treat symptomatology or your symptoms with a drug or a simple procedure. It's to get upstream to why it is you have that. Whereas conventional medicine is more the medicine of what pill to give, what procedure to have, what surgery to have. Functional medicine is the medicine of why. Why do you have these symptoms? We're seeing people sicker, faster, earlier than we ever have before. We're looking at levels of chronic, low-grade, systemic inflammation. We know that chronic inflammation is a main component of chronic degenerative disease. Suddenly, we have levels of inflammation that we've never had before. Issues with immune system dysregulation, endocrine dysregulation, nutritional deficiencies. We know that the majority of us are insufficient or deficient in vitamin D. It's basically a sunshine deficiency. Magnesium, the relaxation mineral. So many things that are not in our foods anymore that used to be in our foods sometime around World War II. It's been 70 years where a lot of things have changed, including those toxins that we now have 80,000 or more chemicals in our air, our water, our food that didn't used to be there before. We're not looking to make a diagnosis. Patients come with a diagnosis already, and that's where we begin. Conventionally, if we made the diagnosis and put a number to it, put a code to it, then we were able to use an FDA-approved drug or some surgical procedure because of that diagnosis. We were done. In functional medicine, that's where we begin. We begin with the diagnosis. You're not going to leave a functional medicine physician's office with a diagnosis. There may be a health impression, but we're not looking to give you a diagnosis for a code to treat it with something to hide the symptoms that are inclusive of that diagnosis. If you have certain toxins in you, we can work to get rid of them. Ultimately, we are looking to identify what it is that you shouldn't have in you, that variable, and work to get rid of it. We're also looking to identify what it is you should have in you that you don't have and work to put it back into you. And ultimately, that genetic blueprint will pick up over a period of time as we get rid of the bad things and put back the good things, ultimately, if we want to put it in just a simple little elevator speech.